My name is Callie Hunter, Skills Lab Coordinator at North Central Missouri College, and today I will be demonstrating how to do a port access. First thing that you want to do is to check your physician's orders, clarifying that you will be putting or accessing the port, whether it be for fluids or medications or whatever the reason. Make sure that you check your orders. The other thing is you want to gather your supplies that you're going to need. You will need a sterile central line dressing kit. You will need a safety Huber needle, and you will also need a 10 milliliter flush of normal saline to access that port. Next thing you want to do is go ahead and knock and enter the patient's room. Hi Gregory, my name is Callie. I'm going to be your nurse today. It looks like your physician has ordered us to access your port today. I know that you've had this done before. Can you go ahead and just clarify your name and date of birth? They have done that. Next thing I'm going to do is just go ahead and wash my hands. So I'm going to wash my hands. I'm going to apply gloves. And I'm going to ask the patient, Gregory, are you allergic to anything? I just want to check allergies to ensure any of the solutions and things that I will be using they are not allergic to. The other thing, depending on the policy of where you work, they may allow you to put Emla cream on or a numbing cream. You could look at that policy. If so, you would want to put that on about 45 minutes to an hour before you are ready to actually access the port. Next thing that I'm going to do, Gregory, is kind of position you. I'm just going to kind of sit you upright. I want to actually palpate that port and kind of feel the size of it. Also, I'm just ensuring that there's no discomfort or pain around that site. I can feel that it is fairly, sticking up there close to the surface. Again, they don't report any discomfort or anything. The other thing that I may do is have that patient either turn their head away from me or actually apply a mask to that patient. That way they're not breathing over the sterile field that I'm going to have. So I'm going to go ahead and position their head away. The next thing I'm going to do is go ahead and just remove my gloves. Then I'm going to wash my hands again and get kind of set up for accessing the port. So next thing that I want to do is to go ahead and open my sterile kit. Inside my sterile kit, you'll find a mask. So I'm going to go ahead and apply that mask to myself. And again, that is just to ensure that I'm not breathing any bacteria or anything like that over that insertion site. The next thing that I want to do is to go ahead and remove my sterile gloves from the kit. I'm kind of pinching those up just to ensure that I don't touch anything else in there. At this point, I'm just going to set those to the side right now, and I will apply those here in just a little bit. Next thing that I want to do is open up my Huber needle, and I want to place that inside my sterile field. So I'm just going to open that and just drop that into my sterile field. Next thing that I want to do is open my 10 cc flush of normal saline. So I'm going to go ahead and open that. And guys, these flushes, if you read on the package, it does tell you do not place on sterile field. Okay, therefore I am not going to place it into my sterile field. I am just going to open that and place it on the top there. Next thing that I want to do is to go ahead and open up my sterile gloves. And what I'm going to do is just apply one of those sterile gloves to my non-dominant hand. Okay, so I'm going to go ahead and open this, donning my sterile glove onto my non-dominant hand first. If that does happen in real life, I would then get a new pair of sterile gloves, as mine have ripped. I would get a fresh set. The next thing that I want to do is to go ahead at this point and with my now sterile gloved hand, I'm going to grab my Huber needle and I'm just going to grab it so that I can attach my saline syringe to the end of the port. So I'm going to use my non-sterile hand, touching the non-sterile saline syringe. I'm going to remove that cap. I am going to push the little air bubble out that does form the top of your syringe. Okay, I am going to attach that then to my syringe. And then I'm just going to go ahead and flush my line. Okay, and that's again to prime my line to ensure that I'm not going to inject any air into that patient's line. Okay, next thing that I'm going to do is I'm going to carefully set the sterile part of that back into the sterile field and then allow the saline syringe then to not be in my sterile field. Next thing that I'm going to do is now go back and don my sterile glove onto my other hand at this point. Okay, so now what I'm ready to do, both of my hands are sterile at this point, is I want to go ahead and just remove the cap off of this needle, off of my Huber needle. Okay, I'm going to use my non-dominant hand to actually go ahead and get my, or actually I'm going to use my dominant hand, get my ChloraPrep cleanser. I'm going to squeeze that to activate it, and I am then going to scrub the site for 30 seconds. So I'm going to do that a full 30 seconds back and forth. Okay, we're going to say that it has been 30 seconds. I'm then going to allow that to dry. Once that dries completely, I'm going to go ahead and using my dominant hand, I'm going to pick up my Huber needle. Okay, it does have little butterfly wings that you can kind of get a hold of to get a good grip. Next thing that I want to do is I'm going to use my non-dominant hand to actually go ahead and touch that site at this point so that I can stabilize. So I'm going to stabilize the site there so that I can feel, and I want to go right into the center of that site at a 90-degree angle, and I want to put enough pressure injecting that you'll feel that hit the back of the port. So on 3, Mr. Brand, 1, 2, 3. It goes right straight in. Okay, once you have accessed it, I am now going to pull back to ensure that I do have blood return. We're going to say at this point, guys, that yes, I did have blood return come back into the line. If you do not get blood return, you do not want to go ahead and flush that. Next thing that I want to do is to go ahead and flush the site using my 10 cc's of saline, and you kind of want to pulsate as you're doing that to clear anything out of the line at all. So I am using a pulsing sensation. Okay, so I'm going to flush that in, and I can just leave that for a sec. Okay. Next thing that I want to do is to get my sterile op site. I'm going to remove the backing off of there. And I am now going to place my sterile op site over the insertion site. Okay, so I'm just going to place that on. You don't want to put gauze or anything underneath the site because that kind of keeps you from being able to see underneath there. So I'm going to place that on. Remove this. The next thing that I want to ensure that I do is I want to clamp my line under positive pressure, meaning as you're pushing in, you want to clamp that at the same time. So I'm going to clamp that off before you actually take the syringe off. Otherwise, you can get blood return back into your line. So I'm going to go ahead and clamp that, and I'm going to then remove the syringe. Okay. So next thing that I want to do is I want to label that insertion site with the date, time, and initials according to or whatever your policy is at the facility that you choose to work. Okay, so I'm going to fill out my initials, the date, the time. I'm going to apply that to their site there. Okay, and then if I was going to hook up any fluids or any type of medication, I could do it at this point. Lastly, I would go ahead and remove my gloves, clean up my area, clean up all of my supplies. I could remove the mask from that patient, or they can then turn their head back around again. Okay, I would remove all of that, wash my hands, make sure that the patient is comfortable, my side rails are up, and that concludes how to do a port access.